Thank you all for coming in. I'll be your instructor today. I'm Chung Brewer. Let's get started. I have some slides here, so you'll still see my face and you'll still see the slides. I think if you're a fan of our starter pack, our stuff on Etsy, if you're a fan of our website, you know our kind of way of just wanting to give you the information. Let's not beat around the bush. Here's the answer. Here you go. We're going to try to do that as much today as possible. Get to 3 big points of this roadmap. That's what I want to talk about today. The roadmap itself is this course that we're offering now. We can't do it all in one night, so we want to give you, okay, what are the 3 things from each of the modules that we really think will be helpful to you? And this is what I want to present today. So thanks for joining me. I have my notes so you'll hear me rustling papers. I got my mug, good oral hygiene. Let's get this started, especially for Lithuania, where it is 3 a.m. Okay, welcome. Thank you for coming. You're in the right place. I think from our emails, it should be clear that we're all about helping the new adult speech therapists. I'll refer to speech therapists a lot as SLPs because that's what it's like in the States, speech language pathologists. So I'll refer to new baby grad SLP Chung Hwa a lot, and I just mean a new graduate. When I say CFY, clinical fellowship year, it just means new grad as well. But also feel free to stop in the chat. If I say something that's an Americanism, just let me know. I'll refer to grad school as well, just our master's degree program. But you're in the right place. If you're a graduate or master's student, if you're a clinical fellow or a new graduate, you're coming back after a break, if you had a baby or you just didn't work for a while and you're coming back, you're switching from peds, or you just want a framework to support your practice. Hey, California. So you're in the right place if you are any of those or several of them. And you're also in the right place if you want the best for your patients and you also want a better work-life balance. There is a way to get both, I promise. When I was a new grad, it did not seem it was that way, but I figured out how to work smarter, not harder, and I want to teach you that today as well. So if you're any of those, you're in the right place. This is essentially what I want to talk about today. The 3 main points: assess, document, and treat. Essentially, I want to just give you a formula of how to assess, how to choose which assessment to give first. Next, how to document using a formula, how to translate those results from the assessment into goals that make sense, and how to treat using a formula again, how to hit the ground running with treatment, how to do treatment tasks that are functional and make sense. And then we'll also talk about the single most important thing to help all patients. And we'll try to do that within 45 minutes. So you could go to sleep for those of you in Europe and Australia. Okay. So I think a lot back on how I was as a new grad, a new student, where I felt like I had a lot of book knowledge and a lot of smarts. I learned a ton at university. And then I went into my internships and it was still hard. I was like, wait, I just went through all that school and this is still really hard. Or I was in the job for a while, but the job wasn't what I expected. Or you're still in the job and you're trying different things. Maybe you switched jobs, maybe you switched your schedule just to make your day feel a little bit better. And still something feels off. This is from my personal experience. I don't know about you. If you've ever felt like this is hard. You're really smart. You know you're smart. You have a lot of education, but it's still hard. And I made this because I've been there. And I say we've been there. I'm also referring to the peer reviewer of this course and my mentor, Alicia. She'll be on later today to introduce herself. We've been there. This is why we created the roadmap and why we're doing this webinar today. We know what it feels like to have that stress or that tight feeling in your gut this is where my stress goes, my gut or my throat, just kind of feels like it closed up. So yeah, I was that clinician who did not handle her stress gracefully. I don't know if that's just me, if any of you had that experience. I was the intern that was internally melting. I was not doing okay. Hence why I made this course. So the issue with like having all these book smarts, but then still not feeling prepared, there is actually a gap. We're not actually taught how to do the job. So, you learn all the signs and symptoms for aphasia or whatever. And then you meet somebody who has aphasia and you're like, this doesn't directly translate. Like, what's going on? Is there something wrong with me? No, there's not. There is a disconnect between what we're taught in school and what we're expected to on the job. I teach at a local university, and my colleagues are the professors who are in charge of what the students should learn. And they readily admit there is a gap in what we learn. So the gap is known to even our professors. And yeah, we could get a doctorate, go to school forever and do it that way and hope that we could gain all the knowledge. Or we could stay on the job and be stressed out for a few years. I want you to avoid that. This is why I made the roadmap. It's kind of like a shortcut, essentially, why I made this roadmap. Excuse me. So yeah, my current life goal is to try to fill that gap for you, so you don't have to get that tight, stressed out feeling in your stomach like I always had for years as a new grad. I don't want that for you. So there is a flow I figured out from 5-6 years of working and trying to figure it out. There is a flow to speech therapy, and it's the same with like any setting that you work in, with any patient, any diagnosis. You do certain things step by step. Regardless of even the experience level of the therapist, there is a flow. And I spent the last 1.5 years or so trying to figure out this flow. And that's called the roadmap. And that's what we'll talk about a little bit today. So you could take these steps when you use them with your patient, because you could see where you're going to go, then it's so much easier to hit the ground running with therapy. So much easier to plan goals, to plan tasks when you know what to expect ahead. And a lot of times you just don't get that unless you've been on the job for years and years and years. But yeah, I want you to not have to go through some of that for sure. So the goal of using the roadmap, I want you to assess, document, and treat with confidence. So maybe you could do it, you could kind of force your way through it, but I want you to feel confidence. I want you to be able to write excellent goals pretty quickly. And I want you to have a balanced and joyful life. I think back of new SLP Chung, she did not have a balanced and joyful life. Her patients were always on her mind for years and years and years. Wake up thinking about my patients, go to sleep thinking about my patients. I wanted to do a good job, but there was just like something missing. I don't want you to go through that. I want you to have a balanced and joyful life, which I have now. So I'm grateful for that. It took a while. So I want to open this up to you. If you felt confident, prepared, and supported in your job, let's get ourselves in that right mindset. What would you do with your free time? Let's pretend it's the perfect world. You're a baller SLP or SLT. What would you do with your free time? Naps. Yes, take care of myself. Yes, please do that. Heck yeah, travel, community theater, awesome. Oh, yes, surviving, not thriving. Dog moms, dog parents here. So fun. I love all these things. Yes, Korean dramas. As much as you should be. You're doing extra work right now. Okay, I love all those things. Yes, I would binge watch Bridgerton and K-dramas. Yes, awesome. Thank you for sharing. And also I want to take a poll. Where are y'all on your journey in speech therapy right now? Miwa has a poll. CF. Awesome. 16 years. We have a veteran. Yay, got so many CFs. Awesome. 7 years. Aw, 20 years peds. That's amazing. Thank y'all for coming. Right on. 2 weeks of internship. Right on. You're in the thick of it. Actually, we're all kind of in the thick of it still. Switching from EI. Right on. You are all well prepared to do a great job. Oh, yay. Hey, research, what's up? Thank y'all for sharing. So we would do all these wonderful things with our free time. I want you to keep that in mind as we go along this roadmap. Think about how ways that you could apply it to your patients now, if you have patients right now. And then how would you feel if you could just easily do the speech therapy? How would it feel for you? How would your life change? Let me introduce myself. I'm Chung. That's me in the photo, wearing the same blazer. I own one, so I look professional. That's the university I teach at. It's a medium public university here in Washington State. I'm the author of the starter pack, making PDFs and stuff for new SLPs is my jam. This is why I do it all. Yeah, the starter pack. We sell it on just Etsy right now, and we got people from like Australia buying it. Where else? I think Dominican Republic, Georgia, the country, all over the world. It's an awesome one. Yay, starter pack. I'm so glad it's helpful. Oh, you went to Western. Small world. Yes, I teach at Western Washington University. And this is me in the past. That is graduate student Chung crying in her car. I don't know if any of you have had that experience or if you handle stress better than I did. That's a piece of paper that said I could graduate and I don't have to do grad school anymore. So those were tears of relief and probably trauma, if I'm honest. Okay, some people, okay, I'm not crazy. Okay, I'm glad I am not alone. I'm just like, is there something wrong with me? Am I just not resilient? PTSD, yes, that is legitimate. So you all get it. I felt overwhelmed. I was working at the time, at least, it was the largest medical center in the world, the Houston Medical Center. I was in an inpatient hospital with 900 beds. And I know my grad program did prepare me well, but I still felt so overwhelmed. And then, I did inpatient rehab for a while, acute care for a while. I was in skilled nursing facilities for a while, home health for a while. I did the outpatient at my grad clinic. And this is a picture of me and my son, and he was a baby. I did home health for a while, like I mentioned. And then I'd come straight to have dinner with my family. This is us eating out. I have a migraine in that photo. I remember that. I just had a wonderful session with a man who had aphasia. But yeah, just like working through it. So I've been in the trenches too. I know what it's like to try to have to balance that work-life balance. I know what it's like to feel the PTSD. And yes, grad school is not easy. Grad school is hard. So yeah, I just want to, I don't want people to have to go through that as much as I did, I guess. That's what I have been trying to do. And me and my cohort in grad school, we would joke like, I wish there was a book that would just teach us how to do the job. And that's literally what I've been trying to do for years. I wrote this book, the Adult Speech Therapy Workbook. It's as big as our publisher would allow it to be. It couldn't be any bigger. So then I made the starter pack because I still had things I wanted to say. And the starter pack still wasn't big enough. So I did the roadmap. I'm just making new things for people so they don't have to go through the same heartache and stress that I had to go to is my jam, is what I'm trying to say. Alicia, who is my mentor, will be popping on. She's had 15 years of experience in a variety of settings. Oh, thank you. You're welcome. My pleasure. She was my unofficial mentor. I had another mentor who was awesome too during my clinical fellowship year. She peer reviewed this course, the roadmap course that I made. She helped make PDFs and stuff. You might have seen her on our YouTube videos and things like that. So we're here for you. We had very different experiences. I had her as a wonderful mentor and another SLP as a wonderful mentor. She had like a very MIA mentor. So yeah, we've been there and feeling lost, and we don't want people to feel that way too. So throughout our years of experience, the kind of heartache that we've been through, we realize there is a predictable flow of speech therapy. Why does this matter? It saves you time and effort. When you could just see, when you know what the next few steps are down the line, then you could just better prepare for sessions. Be more decisive because you know what to expect. And we literally write down every step for you in the roadmap. We'll talk about a couple of steps here. We wrote it down for you. We want you to know the flow. We teach you the flow, and each step of the way, each step of the roadmap, we give you like a ton of PDFs. So if you like the starter pack, we have a ton more PDFs. PDFs are my jam. I'm a visual learner, so that's why I make PDFs. In the roadmap course that we offer, we have 4 modules, we call it. Balanced and Joyful Life, Assess, Document, and Treat. We don't have time to go through it all tonight. So I just picked pretty much the first step of assessment, documentation, and treatment. And that's what we'll talk about today. So the full roadmap is that step-by-step guide for you to use, should you choose so. So let's get on to assessment. Vocal hygiene. Don't yell. Yeah, I'm excited too. Thank you, Jennifer. Okay, so let's get kind of a reading how you're feeling in the traffic. You don't have to answer this in the chat, but essentially what I'm trying to ask you is, how are you feeling in your assessment abilities right now? If you're in the red, maybe you're feeling unsure. From my experience as a new SLP, when a eval popped up on my schedule, I got a new referral. I'm reading the chart. I'm reading the admission packet, and there's so much information and I don't know where to start. I was in the red a lot for a good 1.5 years, I would say. After a few years, maybe 2-3 years, I felt in general confident on what to assess first. But if the patient presented really differently than what they were on paper, then I'd have to kind of scramble and freak out. And green is when you're feeling confident, when you've been in the game for a while, when you kind of get the flow a little bit, you're flexible, you're confident. Even if you have a busy day, you know you can handle it, kind of thing. The goal of the roadmap is to get you to the green. We want you to be decisive, flexible, and confident. And instead of worrying about all the paperwork, which is legitimate, but also enjoying the people in front of you as well. Enjoying that human being. So we learn about all the signs and symptoms, all the diagnoses and stuff in grad school. But then suddenly you're standing in front of a patient. What do you do? Some of that kind of goes out the window. There's not a direct translation here. So here's a really simple formula. If you don't remember anything from the assessment portion, remember this: assessment formula overview. In the roadmap, you actually get like a whole 3-page PDF of a flow chart of what to do. I'll kind of review that quickly today. Number 1, we kind of always prioritize swallowing. So if they have any swallowing red flags, you do that, a clinical bedside swallowing evaluation. If not, you're usually going to do the cognitive communication evaluation and other evaluations. So let's talk about these all right now. So you have a chart review, you're reading through their diagnoses and everything like that. Are there any swallowing red flags? And the reason we want to focus on swallowing first, this can impact physical safety so much. Let me back up a little bit. If you really break down what we do, we're the swallowing and the communication therapists. So they were referred because they're concerned in one of those 2 areas, either a swallowing issue or a communication issue. So you're just trying to figure out what to work on or what to assess first. Usually it's going to be swallowing first because it can potentially impact negatively their physical health. We want to keep them alive. Yay. So if they have any of these red flags, I like to break it down broadly. Is there anything going on with their mouth, lips? So anything that says labial, lingual, if it has anything to do with the structure or surgery or anything like that. The throat, these are keywords you could look for: pharynx, epiglottis, even things like GERD. If there are any diagnoses related to the central nervous system, respiration, cardiovascular, or any kind of more broad issues like a CVA, something like that. Usually if you see any of these, then you're just going to do a swallowing eval or at least a swallowing screen with a good chunk of your patients. So if you see the swallowing red flag, print out that clinical bedside swallowing evaluation. When you sign up for the roadmap course, you get the clinical bedside swallowing evaluation. If they don't have like any red flags at all, if swallowing doesn't seem like a concern at all, then look for communication red flags. Is it a swallowing thing or is it communication flags? So communication is, of course, really broad. It goes all the way from cognitive communication to like fluency disorders and AAC. So it's pretty much everything else that we do besides swallowing. So is there anything going on with the brain? Any diagnoses related to CVA, TBI? Cardiovascular things too can affect, breathing, respiration. So things like myocardial infarction. Don't worry too much. I know I put a lot of abbreviations there. That means myocardial infarction, hypertension, DVT, deep vein thrombosis, excuse me. Anything to even do with the renal system, especially people who've had dementia or mild cognitive impairment. A UTI can really affect their cognition, and other issues like COVID, diabetes, especially type 2 diabetes, and need for supplemental oxygen. So this is a broad thing. A lot of our patients, we're going to do the cognitive communication evaluation. So if they have any communication red flags, print out that CogCom or CogLing evaluation. If the answer is no, they don't have any swallowing or communication red flags, check back with their chart, because that's almost always the case. You got a referral for a reason. For whatever reason, the physician is sending you this patient with a chart review, trying to figure out why. It's almost always one of those two, unless they were referred for like a very specific issue, or they just were discharged by another speech therapist, like they have like a very specific voice issue, then you could go straight to a voice eval and, not have to do the swallowing or the CogCom. But almost always it's one of those two. Do at least one of those two, the swallowing or the cognitive communication, during your first eval. So if there seems to be no problems, maybe you just have to do an eval only if they're at previous level functioning, if they're within normal limits on everything. Or you could do one of those more specific evaluations if there still is another issue that's impacting their ability to communicate effectively and or efficiently. Give your best educated guess. You earned that graduate degree, that master's degree, so give your best educated guess. You earned that, right? These are other evaluations that you could use. You get them all. They're part of the starter pack too. They're part of the course that we're, the roadmap course. Give one of those. You're gonna have to give one eval during the first day. You have 6 to choose from. It's usually the top 2. So that was a really quick rundown. Let's get back into our feelings. It's a perfect world. You're feeling confident. How would you feel if you knew exactly what assessment to give every single time? There was no heartache and stress over what do I need to prepare? Do I need to find a pirated version of a battery online? Don't do that. I'm not condoning that. How would you feel if you knew exactly what assessment to give every time? You could say it in the chat box. Especially if this is an area of stress for you. Relieved like a goddess. Ah, yes, blessed. Fantastic. Good feelings, relaxed, ease. Again, through your textbook knowledge from reading journal articles, doing CEUs and stuff, you know kind of how to document. We learned the generally how to document. Through the assessment, you generally know the patient's strengths and weaknesses and speech therapy related areas. Now you have a bunch of data on your piece of paper. Let's take in a traffic assessment again. New SLP Chung would feel just like, okay, I have like pluses and minuses on this assessment chart. I know how to turn those into percentages. But what does that mean? What does 70% language expression mean? And how do I turn that into a goal? Like I couldn't figure out how to take this these random looking numbers to me and make him so I could help an actual human being in front of me. So that's how I felt all throughout grad school, for sure, at least the first 6 months into my CFY. A couple years in, I felt some confidence. I could generally see if I was going to treat a swallowing issue or a communication issue. But it was still like really broad, especially if I was trying to come up with like a speech therapy diagnosis on the spot. It was hard for me to even kind of fathom what specific goals to make, versus now when even while you're assessing, you can kind of laser in on, oh yeah, they have this issue, and just get more and more specific. Once again, we want you to be green. So the point of the roadmap is to step-by-step get you to that green where you're just like really decisive about, even as you're going through the eval, you're asking yourself questions so that you could figure out speech therapy diagnosis. You're looking for patterns as you're going through assessment. That's just part of the roadmap. We want you to get you to the green. So think of that feeling about being confident, flexible, and decisive as we talk about goals. Once again, if you don't remember anything about this documentation section, remember this formula: treatment area, underlying cause, priority, goal. This might not make total sense right now, so let's talk about each of these right now. In general, for treatment area, at least, think of the big 9. American SLPs will know about this. So like swallowing, motor speech, memory, attention, fluency, that's the treatment area. And then the underlying cause is the root thing you think is causing the problem. So it's like, what are causing the signs and symptoms? What's the underlying thing? Let's talk about priority next. So let's get in the headspace. You're still in the room with the patient. You just assessed them. You have all these plus and minuses. You figured out percentages. You have that all on a piece of paper. And now the patient is just sitting there and they're kind of like waiting for you to do something. So how do you figure out what you're going to work on with them right there, staring at you, waiting? I want you to zoom out. I want you to remember why we do speech therapy in general. Look at the patient as a whole. Don't just zone in on one abnormal swallow for now. Why we do speech therapy is for the patient's safety, independence, and quality of life. Any goal that we do can be sorted into one of these 3 things: safety, independence, quality of life. When you're making goals, you want to think about that. So when you have a patient who has 70% on simple language comprehension, well, what does that mean? What do I do with that? A patient coughed a few times while eating regular textures and throat cleared a few times on soft and bite-sized food. What do I do with that? If you're anything like me as a new grad, I'm like, okay, I observe that. Now what do I do? Let me tell you what to do. First of all, as you go through the eval, I love having the printed out form in front of you. Circle out the sections of like the obvious strengths and weaknesses. And from there, look at patterns. And the pattern can be as broad as, oh, I circled a lot of sections and they had a hard time in the language comprehension section of the cognitive communication eval. That's great. Then the pattern could be, they had trouble understanding me. Even something that broad is something you didn't know before and can help you eventually get to goals. So give yourself a pat on the back, figuring that out. As you go on, you could try to be more specific. You realize, when they were reading, they did slightly better when I was just like giving it auditorily or verbally. So they did better when they were reading. That's even more information. So even something as broad is great. It gives you great information. It doesn't have to be perfect in the beginning. As you work with the patient more, you're just going to learn more about them. So try not to feel the stress of like, I need to know everything about the patient like right now. It's impossible. We all know that. Or as my 3-year-old says, it's impossible. So don't worry about trying to understand all of them right now. You're only ever going to get a snapshot of this patient whenever you see them. So it's okay if it's broad for now. You could still make functional goals that make sense for them by keeping it broad. So you see that the patient received a 70% on, let's just say, simple language comprehension. You realize that they have a hard time understanding me. You figured that out after circling the strengths and weaknesses section. And then you could conclude that they may have difficulty communicating their basic wants and needs. If they have a hard time answering my yes or no questions in this quiet environment, when I'm like the patient speech therapist, waiting for them to answer, they're gonna probably have difficulty communicating their basic wants and needs. So a direct goal is work on increasing ability to communicate basic wants and needs. And that's part of, it could be part of the safety. If we zoom out, it could be safety. If they're having pain and they're not understanding the pain scale, that could really impact their safety. If they're having headaches, but they're not able to communicate that, even when you ask, do you have pain in your head? That can impact their safety. And it could definitely impact their independence and quality of life as well if they have difficulty with simple language comprehension. So always kind of, you zoom in and out a lot when you're doing therapy. Sometimes you have to zoom out and think about, is this a safety issue, quality of life issue, or independence issue? Let's talk about a patient who has dysphagia. They coughed a few times while eating regular textured, throat cleared with soft and bite-sized food. You could conclude that they may be at a risk for aspiration, which impacts their safety. So straight shot goal, don't overcomplicate it. Don't reinvent the wheel. A goal could be increase safety and reduce risk for aspiration by introducing strategies to them. If you're anything like I was as a new grad, I just felt like each of my patients' goals had to be different. They had to be really unique. I realized for most people, you could have the same goal or really similar goal, and it's just as functional. So keep it simple at the beginning. You could always fine tune the goal. That's the beauty of goals. You have progress reports, or you could just change the goals if it's not right for the patient right away. So don't reinvent the wheel. Don't feel like you have to make these amazingly specific or anything goals. They can be just as functional, just as useful for the patient by keeping it simple. So you want to increase safety and reduce risk of aspiration by using strategies with this patient. You could also write it this way, coming back to our formula, that swallowing goal. The treatment area is swallowing, keep it broad. The underlying cause, maybe you realize that everything's moving slow, feeling kind of sluggish. They're not moving a lot. Range of motion is impacted. And you realize, oh, it's like a weakness thing. So I could have a goal of safely swallowing diet with strategies and exercises, something like that. For that patient who has aphasia, we want to increase their independence to communicate their basic wants and needs. We'll give them an AAC board, a simple needs board, if that helps them. Maybe you have a patient who has a cognitive disorder, memory disorder, but you realize that the underlying thing isn't a memory issue. It's actually an attention issue. So we want to increase quality of life because they're not able to remember things in their life. So to recall functional items. So especially when you're making a goal, think of it belonging to a safety, independence, or quality of life. How can I keep my patient safe, independent? How can I keep their quality of life as high as possible, whatever it means to them? It's going to depend on the patient. And the only way you know is by interviewing them. So let's get in the headspace. Pretend you have assessed, you have goals, and now you can actually do the therapy. So much work. I think this is a reason why a lot of us got the job is we kind of pictured ourselves, I don't know, maybe King's Speech style, like, yeah, I'm helping people. I'm doing the therapy. They're really engaged. They want to be there. So we finally got to this point where you're in the room with the patient, you could start treating them. So when I was a new speech therapist, I was definitely in the red. How could I possibly know what therapy would work best for my patient when there's so many options? I literally have written down here analysis paralysis. Thank you, Sherry. You great minds, right? It took a good long while for me to get more into the yellow. You've done certain treatment plans for a few times. You hit the ground running with the patient, even during the eval, okay, I think I know what we can do in speech therapy together. But there's still a lot of planning time involved when you're in the yellow. Once again, we want you to get in the green when you're feeling confident. And the moment you're done with the assessment, you have a couple of options that you have in mind. You know what strategies you could use with your patient. You even know what task, because you did an interview so you know what your patient likes. You can make it person-centered and culturally responsive and all of that. These things are fun and effective, and they're functional for the patient. We want you to be at the green. We designed the roadmap for you to be at the green. So let's talk about the first step of the treatment roadmap. Once again, if you don't remember anything, remember this treatment formula overview. Choose a general treatment area. I know that's so broad. How do you choose one? Prioritize safety, independence, or quality of life. We teach you how to do that in the roadmap more. Then I want you to start teaching your patients 1 to 3 strategies, even on assessment day. Don't leave that assessment room or don't leave that patient that day without giving them some strategies. Practice the strategies during treatments, and then the patient uses the strategies independently. And the rest of them, they don't happen all on evaluation day. This is generally how treatment flows in this way. I use this term day 1 handouts and worksheets. I consider day 1 immediately after the assessment. You're still in the room with the patient. You talked about possible goals to work on. Let's work on communication together. Let's work on your swallowing. We'll do exercise together. You say a little spiel like that. In the roadmap, we tell you exactly what to say, or in generally what to say. These day 1 handouts and worksheets, like, okay, I just made you do a lot of stuff, at least some of which was uncomfortable. I'm not going to leave you empty-handed. Here's this connection between what we did in the assessment to what we're going to do in treatment. So there's more of a connection point. So they're not like, what did I just do? Who is this person? And why did they make me count backwards by 7s? You're giving them informational handouts like anatomy and physiology worksheets. You're even giving them like basic homework to do, especially for the more mild or borderline patients, so they could hit the ground running. Again, the roadmap will teach you like what to think about beforehand and what you'll do after, so that you know what to prepare, what to even bring into the assessment room with you. The single most important thing that helps all patients is strategies, which isn't sexy, sorry. It just is what it is. Things like clear speech strategies, memory strategies. So why strategies matter, why I like them so much, is it's going to help with that carryover, that generalization from the home life. Patient learns how to use them with you, but they can continue to use them for the rest of their lives. It's a gift that keeps on giving for our patients. So yeah, like the things like the memory strategies, safe swallowing strategies, the breath curve, and clear speech strategies. Here's a metaphor. I'm a visual person. So when I am starting out with the patient, I consider that I'm like their coach. I'm the person at the bottom there holding the line. And I am, especially at the beginning, I have the line, the safety line for the patient, and I'm telling them exactly where the handholds and footholds are, giving them a lot of cues, a lot of prompts, a lot of support so that they could get up to the top. What's going to help them each step of the way are their short-term goals, and also how they learn how to move their body is the strategies, is what I would consider. So there's a lot of parts, but it's really the strategies that are going to teach them how to even move. So in therapy, you might not even be on a rock wall at first. You're just practicing climbing things around the therapy room. Maybe you could get them out into a functional environment where they're climbing more, but you still have the safety line. But the goal is you take yourself out of the picture. They're there by themselves or with a caregiver if they need it, but they still know how to move because they have those strategies. If you are totally confident in your decisions, day 1, you're like, I got this. How would that affect your life?